Now, the National Institute for Communicable Diseases is working with Unicef to investigate the measles outbreak in Gauteng. A number of cases of the highly contagious virus were reported across the province just last month. Parents and caregivers are being urged to make sure that their children's vaccinations are up to date. But the Executive Director at the NICD, Professor Adrian Puren, joins us now to give more clarity on this matter. Prof, thank you so much for your time and good morning to you. Is there reason to be concerned with this outbreak?
There's always reason to be concerned. As you said, this is a highly contagious virus, and in fact, like SARS-CoV, it has a what we call a high R value. Fortunately, we have a vaccine program in South Africa for measles, and it has achieved a certain level of coverage, but there's always concern because we've not achieved that full coverage of 95% in terms of the first and second doses. So there's always a risk, given that there is this immune gap. And of course, this may have been exacerbated with the last 2 years in terms of COVID-19.
Yeah, I mentioned earlier on the importance of parents and caregivers ensuring that their children's vaccination programs or vaccinations rather up to date. How important is it? Why is it significant? And what can they do now should they find out that they've missed a couple of vaccinations?
Absolutely. So it's really critical. So just to a slight correction, in fact, the Department of Health in Gauteng will be the main leader in this particular activity. In other words, it's really looking at what's happening in that particular area where the outbreaks have occurred and offering vaccination to those that have been unvaccinated, as well as the schools where this may have occurred. So that's the critical component, is really what we call a ring vaccination campaign, and offering vaccination, and they may have actual campaigns to ensure that in particular those that are less than 5 years of age are vaccinated. So even if you think that your child may have been vaccinated, but you're unsure because you don't have your card to prove this, revaccination is not problematic. This is a very potent vaccine. It doesn't have marked side effects at all, so there are no risks in the main to children in terms of vaccinating or revaccinating children.
Prof, I think just to simplify it for our viewers, let's take it back to what measles really are, and just simplifying it. We spoke that it's highly contagious. What other side effects or even symptoms should we be looking out for?
Sure. So it's a respiratory disease like SARS-CoV-2. So it's spread by droplets, and it will incubate for 10 to 14 days. And this is followed by, for example, the presentation of fever, cough, runny nose, sore and red eyes, for example, a bit of malaise, muscle ache. So it has general symptoms. This is then followed about 3 or 4 days later with a rash that starts on the face and then heads towards the extremities. A red rash, initially flat and then macula, and then this resolves. And people are infectious that first 3 days when that fever, runny nose and cough start, about 4 days after that as well. It's really highly contagious. In fact, the virus is in circulation, if you like, and can stay there for a few hours and then be transmitted. So I think we should take this very seriously. I think the MPI is quite interestingly may also contribute to us trying to protect, and that may well be the fact that we're not seeing possibly too large an outbreak just yet, but let's see how this unfolds. I'm hoping that it's a dead end at this particular time, but let's see. Let's keep an eye out.
And I was about to ask, because I know that the NICD is working alongside the World Health Organization and Unicef to not only investigate, but to respond to the outbreak in Gauteng. So far, with your work that you've done in investigations, what have you found about this outbreak?
So it looks as if these outbreaks have occurred in adolescents who are likely not to have been vaccinated, because it's unlikely if you've been vaccinated that you're unprotected and it can be reinfected. So that's really critical. So I think it's really important, again, to work with those particular families and in the area and at the schools as well to offer vaccination, especially to those individuals who don't have a record of vaccination. I know that there's a certain degree of vaccine hesitancy, not only about SARS-CoV-2, but also about measles. So again, we need to encourage and overcome the particular fears because, as I said, this is a highly contagious vaccine. It has, in the main, the course of disease is uncomplicated, but you can end up in situations where children do actually end up in hospitals and do die as a result of pneumonia or some sort of encephalitis, meningitis as well. And there may be long-term sequelae. So it's really critical, given that there is this vaccine that's highly effective, that we encourage people to vaccinate their children.
And Prof, are there any adverse reactions after vaccination? After vaccination for measles, are there any adverse reactions that can be expected?
Yeah, so in the main, these are uncomplicated. So again, it can be soreness at the site of the arm. They may have experienced some fever, but in the main, these can be treatable. There are those very, very rare complications of convulsions, for example, but very rare at all. And so I think the concerns or the balance is really towards vaccinating your child rather than not vaccinating your child, given that the severity of this disease is such that that can lead to death.
All right, we'll leave it then. I appreciate you speaking to us about this. Professor Adrian Puren from the National Institute for Communicable Diseases. Thank you so much for your time this morning.